Hey there, I'm John from HB Pharmacy. How are you? I'm a compounding pharmacist, and this little guy is my buddy who's a rescue, Finnegan, or Finn for short. And he's joining us as a special guest for today's video, right? Right. So, do you have a finicky feline who won't take their prescribed pill or liquid that your veterinarian prescribed for a medical condition? So, finicky cats, we're all familiar with that, and sometimes it's very difficult. So, you could consider having your vet write a prescription for a transdermal gel with that medication in there. So, we're going to assume today that you're watching this because your vet has now prescribed this transdermal gel, and you want to make sure you use it properly to make sure that your pet gets the best results from the medication. And again, Finnegan will be here to help us demonstrate. There are many transdermal gel agents we can put into a transdermal gel. I think for felines, especially in endocrine conditions, the most common prescription is for hyperthyroidism, which would be treated with methimazole. And used to have to give Tapazole tablets, but we use the transdermal gel now, and it's much easier, and the cats seem to like it as well. But we also do many other things for heart conditions. So if your cat's on amlodipine or pimobendan, if they have neurological or neurogenic pain, maybe they're on gabapentin. If they have emotional issues, perhaps they're on fluoxetine, which is a generic name for Prozac. Today we're making a prescription for theophylline for a cat who's in respiratory distress and who's an older cat and needs some help. So so we pretty much can try anything. And inside the ear of the cat, there's a lot of vasculature, so there's a great absorption in that pinna. But the first thing we want to discuss when applying a transdermal gel is safety. So safety for you and for your pet. So you want to make sure that you're wearing gloves or a finger cot. That's very, very important, okay? The other thing I really think is important is during this administration of medication is to try to create a relaxed atmosphere. Like, this is playtime. This is where you're going to get your ears rubbed and your whiskers, massaged and your ears and back stroked. And he's just a happy little furball, and he's so excited, right? So you want to make this relaxing so that every day when you have to do this, because things like a thyroid condition or a heart condition, it's a daily thing. So you're going to have to do this. You might as well create a nice environment so when your pet sees you sitting in that certain chair and getting out the medication, it's almost like a ritual, and it's a happy thing instead of like a big struggle, right? So try to do the best you can to create it as a positive thing. Speak kindly and softly, and try to even give a treat, whatever you can do to make them relax. We administer the medication to the cat's pinna. It's the inside hairless area, very important to reinforce hairless area of the cat's inner ear. Again, the inner ear, not the outer ear. Again, it can be absorbed very well there, but even though we at HB Pharmacy use a special base specifically made for transdermal gels to be put inside a pet's ear so that's absorbed very well, a residue can still be left. So it's important to do a little bit of gentle cleaning prior to administering the transdermal gel. I like to do things this way just so I can remember. On an even day, so most transdermal gels are either done once a day or twice a day. So you're always alternating ears. So today being an even day, I would administer the dose, if it were once a day, in his right ear. And prior to that, I recommend, just to get the habit of it, so you're always making sure you clean the ear, clean the left ear before you administer medicine into the right. And this way, the left ear is good to go for the next dose the next day. And what do you clean it with? Well, I wouldn't use a paper towel. I would just use water that's come to room temperature, not cold tap water, but maybe room temperature water. And I would use either a cotton ball or a gauze pad, like a small 2x2. But cotton ball is nice and soft. You don't want the gauze or the cotton to be soaked. You don't want fluid running into the cat's ear canal. You don't want medicine running into the ear canal. You want the medicine to go to the pinna, and you want to clean the pinna. So it's a damp cotton ball, not a soaked. There shouldn't be liquid running down. Okay, so. Again, water should be room temperature, so it's not shocking. So you can always check with your vet. I always recommend, too, to see what they think for cleaning. Sometimes even they recommend certain astringents, but even that's maybe once a week, not every time. Mostly warm water is okay. Again, so if the dose is administered twice a day, I use the left ear in the morning and the right ear at night. And again, each time cleaning the other way. It's just an easy way to remember it. I think that's the way to go. So anyway, so when we're going to do that, we're going to go ahead and we're going to use in our pharmacy here. We switched to something called the TopiClick Micro, and we like that. And our pet owners love it because it's not only easy for them to use, but people have pet sitters coming in, taking care of things when they're going away or if they're at work, and you want something that's easy for your pet sitter to use as well. So this is a very easy device, and it has zero. Each click is 0.05 milliliters. Most transdermal gels are dosed in 0.1 ml, so it would be 2 clicks. So you would just take those 2 clicks on your pen, and then either do one of 2 things. You could take the device and apply it directly to the cat's inner ear, and then rub it in afterwards with your finger, or you could apply the medication directly to your finger and then use your finger that's gloved, obviously, or finger caught on there, and then rub that in gently for 15 to 20 seconds. Again, the cat loves all the attention, so you're making this a positive experience, so it shouldn't be something that you have to rush and anything like that. So again, you would do that, and you would apply it, as I said. Where are you going, Finn? And just massage it in, giving the cat some loving attention, some positive reinforcement, speaking again in that gentle tone, and excuse me, and then pretty much you're done. So once you've done that 15 or 20 seconds, you're all set. You've cleaned the other ear, so you're good for the next dose, and that's exactly how you should use your transdermal gel for your cat. And we thank you very much, and we thank you, Finn, as well, for watching our video today.